Hi class, we're at week 10. We're at the week where treatment presentations are beginning to be due. Don't be alarmed if you see some of the same topics that were presented. There's many of you in this course, so I didn't see a problem if some of you had repeats. This week we're talking about various topics. The first one is caregiver distress. And I can't say enough how big of a potential issue this is going to be. Um, it is some of you may be caregivers and you can relate um, a lot to how you could see this being a potential therapeutic concern, why this could potentially bring someone into counseling. And it's going to be even probably more of an issue as we've discussed many times as we've gone through the semester about the larger aging population, um, and how long people are living. There's a lot of extra stress as far as for children to be taking care of their aging parents. It doesn't necessarily have to be a negative thing, and I'm not trying to make it sound like it will be, but there is a lot of stress and a lot of decisions that need to be made. Again, I think because of seeing parents transition in a way um, that you're not used to. You're used to your parents always taking care of you, and it's really hard to make decisions and watch maybe a decline of someone you love. Also, too, dealing with siblings, this could be an area where you're dealing with people that you haven't had to maybe deal with for a long time, and agreeing may be difficult. And this is where, again, some family dynamics may come out and maybe be reopened. Some wounds may be reopened. So there's a lot that can come up, I would say, with caregiver distress. Um, so, again, some of these same things like anxiety, that could be a symptom of somebody declining health due to all the stress and the strains and caring for someone. It can be quite difficult. Um, maybe you feel bad about yourself because maybe you're having to make a decision to not continue to care for an aging parent, and there's a lot of guilt. So you're really wanting to help a person cope with some of these feelings and maybe come to some resolutions and to maybe come to terms with what they're able to do and what they're not able to do. Again, a lot of great therapeutic interventions that are suggested. Again, making a list of stressful events. A lot of, let's see, like cognitive behavioral type things. Your thoughts turn into your behaviors, which turn into your beliefs. Um, so being able to maybe defeat some irrationality, maybe just being a listening ear. This person has no one else to listen to. I have a client right now or not a client, I should say, someone I supervise that works at a different location, and she was saying how she has a client that is coming in, and she is an aging adult that has a lot of needs, and it has put a major strain on her family. So much so where her sister-in-law is basically saying to her husband, you need to pick either her or me. And this is the kind of things that can happen when you take on the responsibility of caring for an adult. It can cause a lot of stress, especially if the adult is living in your home. And like we've discussed many times, just because someone has had mental illness does not mean it goes away when they're older. If sometimes that even means it's even more intensified. So you think of maybe having an adult in your household that's had a personality disorder their whole life, and now they're living in your house, they could cause a lot of turmoil. So I just wanted to remind you of those things to keep in mind if this is someone who eventually ends up in your office. Um, so again, that you might be a huge listening ear, be able to validate them a lot, give suggestions, maybe some resources, suggest a support group, things of that nature that could really help a caregiver who is um, exhausted and tired. Again, reminding them that they are just as important. If they are not taking care of themselves, then how can they take care of this person that they're responsible for? Um, and so these are some things, some disorders that might be associated with a caregiver. Adjustment disorder, anxiety disorder, generalized anxiety disorder, depression disorder, dysthymic, and major depression disorder. So these are some serious things um, that need to be addressed. Again, you never want to rule out medical. And so a person could have medical conditions going on alongside of this additional stress, or this additional stress may have caused high blood pressure, things of that nature. And so being able to refer is important. The next one is communication deficits. And as you know, when an older person starts recognizing there's some issues with communication, clearly you're going to want to refer to a doctor. But there may be some other things going on. And so this has some great suggestions, again, for goals. But you could be looking at some possible signs of Alzheimer's in this department, cognitive disorders, dementia, anxiety. The anxiety may be caused by not being able to hear as well, or you're noticing like you're not being able to respond as quickly to things, and that can cause anxiety for a person. They may not have dementia or Alzheimer's at all, but they're maybe very fearful of that. And so being able to work with the person, assuming they've gone to see a physician, being able to work with them and seeing what the diagnosis is and reassuring them, remember, you don't have that diagnosis, but things are different. How can we work through that? I think that's really important. They're having a hard time making decisions. That's the next treatment planning topic. Um, so being able to work through that. Let's see, one of the short-term objectives is describe in the greatest possible detail the impending decisions, relevant past history, or all involved parties and concerns related to decisions. So really being able to walk through decision-making step-by-step process is huge. I think as an aging adult continues to age, there needs to be certain things in order. And that can be very depressing, and really hard to come to terms with, but it's a reality. So some things that could be associated with maybe when a person realizes they're having an inability to be able to make decisions, it could be delirium due to something else going on. Again, dementia, Alzheimer's, vascular dementia, so something with maybe the oxygen level, psychotic disorder, major depression disorder, bipolar disorder, something resulted to medications. Um, I saw a list of medications someone's on of a new student that just entered where I supervised, and the client's on 10 medications. That's a lot of medicine. And as you know from the commercials that you watch on TV, I mean, some of these medicines, I mean, is it better to be on the medicine or not because of the list of side effects? And sometimes, doctors aren't paying attention to what other medications another doctor's prescribing, and that's why it's important to have a good pharmacist. And so some of this could be based upon a person being over medicated, or their medications are working against one another, causing major dysfunction in that person's life. So again, that's why it's huge to be able to, as a therapist, you might be able to give these suggestions. This person may have had no idea that could be a possibility. Lastly, in this section is depression, and as we know, depression is something, and as any mental illness, you want to, take very seriously, but you want to make sure, obviously, someone is not suicidal. So really being able to determine, the level of safety this person has, making sure that this person isn't a harm to themselves or to others, and then trying to figure out what you can do, what the client can do to try to help themselves feel better, whether that's something medically induced. Even today I learned with Parkinson's, it affects dopamine in the brain. So if a person has Parkinson's disease, clearly it's going to affect their mood stability. And so some Parkinson's medication does help with that. So, once it's diagnosed and the person gets on the proper meds, it may help. But I wouldn't have necessarily known that unless I had done the research. So knowing some of these things about maybe certain disorders may help you to be able to say, you know what, I bet you're feeling depressed because this is what's going on with you. Again, can be very eye-opening and helpful for a potential client. A client may decide to get on psychotropic medication because of the depression. This is where you're looking for grief and loss. Maybe there's been significant loss in the person's life, whether it's of independence or of a loved one. You might be able to assign some reading and some psychoeducational books for the person, like to help them work through whatever it is that they're struggling with. If time is of the essence and they have a lot of time, they might have time to do that. You could refer to maybe some senior agencies that have activities or groups, like even if the person's on a fixed income, knowing of some of those things where they could get involved and feel good about themselves really may help with depression. Sometimes the best thing for a person that's depressed is to volunteer because they feel really good about giving back, and it takes the attention off of what isn't necessarily going right in their lives. So knowing some maybe resources for this person would be helpful. Um, Trying to figure out how they interact with others. Maybe trying to see if there's some friends they can get in contact with, their support system, who knows that they're feeling depressed. It might be, assuming they have a positive support system, this might be the type of situation where you would bring in other family members to help work with them. Or maybe they have goals of like, maybe you need to go to coffee once a week with this person. Um, Trying to give them, resources other than you, I think would be really important. Again, if the client does come up suicidal, you need to make sure that you as a clinician have a plan. So whether that's, they sign a life contract, you have the ability to call a family member if they're in your office and they're feeling, very, very down. You may have to 5150 someone, but being prepared if someone is coming in your office severely depressed, whether they're an older adult or a typical client or a minor, you need to have a plan in place of what's going to happen if someone is suicidal, and making sure you're assessing appropriately for that. Because again, not that not that a younger person wouldn't have access to a way of harming themselves, but an older person may have more access to medication and things that could, harm them. So being mindful of what they have at their fingertips that could um, cause them to really hurt themselves if they so chose. Um, Journaling may be a good option, things of that nature. Really trying to see, is depression something they've struggled with their whole life? What has worked for them in the past? What hasn't worked for them? Really seeking to kind of understand the history of it. I mean, of course, you want to work on the short term, like how are we going to get this better now? But there might be some things that need to be addressed from the past that have never been addressed. And now that they're aging and again have more time on their hands, some of these things are coming up. So you know, just things to think about. Again, there might be some really helpful interventions in here that you would have never considered. So, take these things and put them in your clinician tool belt. Um, and again, some disorders that could be associated, of course, with depression would be major depressive disorder, dysthymic disorder, bipolar, adjustment disorder, adverse effects to medication. Again, being very aware that sometimes all these medicines people are on can cause certain side effects. That might be really good for someone to know. And you may not be able to answer those questions, but their physician can. And starting sometimes a new medication, it might be a side effect for the first few weeks and then it gets better. So always asking a person, whether again an aging adult or someone who's just an average age or even a minor, what is something like what has changed that has sparked this, whatever it may be, a loss, a new med, a new diagnosis, maybe they've changed their eating habits in some way. What's going on? Because if a person was feeling completely fine and then something changed, something has to be going on. Whether it's a thyroid problem, there's a lot of things that are associated with your mood and your body. And, we're holistic, so everything is interconnected. So just be mindful to ask the right questions and to try to be able to refer your clients to the right people. So I guess that is it for this week. If you have any questions, please don't hesitate to ask me. And I look forward to next week. Thanks so much. Have a good day.